Good morning. We'll be starting our presentation in approximately 2 minutes. Thank you for joining us on HCM Awareness Day. We'll wait for some people to come join us and get ourselves started. There we go. A few more joining. Let me move my microphone closer so you can all hear me. And we will be going in another minute. Let everybody join. Good morning, Delaware. For this presentation, we have a video from one of our physicians. The busy life of physicians leads us to have to pre-record them sometimes. So should there be any questions, we're more than happy to address them at the conclusion of the presentation. And we hope that you stick around with us for a few minutes to learn a little bit about HCM and what the Hypertrophic Cardiomyopathy Association is doing to try to identify those who are at risk of genetic heart disease. We'll begin in just one more minute. All righty, let's get this party started. So good morning. My name is Lisa Salberg. I'm the founder and CEO of the Hypertrophic Cardiomyopathy Association. And today I will be presenting a brief legislative overview of the Hypertrophic Cardiomyopathy Association's approach to identifying the undiagnosed and ensuring access to care for all with genetic heart disease. So good morning again. So in the next few minutes, we're going to go over a couple of items. What is the HCMA? What is HCM? What does your state report card look like? We're going to talk about the HCM Act with a specific example of Jillian's story. And then we will talk a little bit about Derek's story and some of our federal initiatives, and then what actions you can take to help make sure that your state is well prepared for HCM in your constituents, as well as preparing for sudden cardiac arrest emergencies. So, who is the HCMA? We're a 501c3 nonprofit organization founded in 1996. We provide information, support, and advocacy to patients, their families, the medical community, as well as the general public about HCM and all of the issues that might be related to those living with genetic heart disease. And it is not because of lack of prevalence of disease. It is lack of understanding of disease that we are challenged today. And we're hoping that this webinar and our other initiatives will help to inform our legislative partners to understand the needs of this particular community. So now we're going to hear from Dr. Wang, and he's going to tell you a little bit about what HCM is.
Hello, I'm Andrew Wong, and I'm a professor of medicine in cardiology at Duke University Medical Center in Durham, North Carolina, where I direct our hypertrophic cardiomyopathy program. I'm also the president of the Hypertrophic Cardiomyopathy Medical Society, and I'm pleased to speak to you today about hypertrophic cardiomyopathy and want to thank the Hypertrophic Cardiomyopathy Association for asking me to speak. Hypertrophic cardiomyopathy is a heart condition that is due to an abnormal thickening of the heart muscle for no apparent reason. In patients with hypertrophic cardiomyopathy, as seen in the figures on the screen, there is an increased heart muscle thickness that oftentimes leads to obstruction of blood flow leaving the heart, as well as disruption of the electrical system of the heart that can put the patient at high risk for life-threatening heart rhythm problems. By the numbers, hypertrophic cardiomyopathy is the most inherited cardiovascular condition affecting 1 in 250 persons around the world. In the United States, this means that an estimated 1.3 million people have hypertrophic cardiomyopathy, and yet only about 1 in 7 are diagnosed, meaning that 150,000 people are diagnosed, but the vast majority are undiagnosed and may be walking around with a risk of major cardiovascular complications. The risk of sudden cardiac death is highest in young people with hypertrophic cardiomyopathy, and hypertrophic cardiomyopathy over the age span can lead to progressive heart failure symptoms as well as risk of stroke. Some patients with hypertrophic cardiomyopathy have no symptoms and have a normal longevity. We're most concerned about those patients with hypertrophic cardiomyopathy who don't have a good prognosis and may have serious complications at any point throughout their life. In younger patients, we are most concerned about the risk of sudden cardiac death. To prevent that, there are implantable defibrillator therapies that have been shown to reduce the risk of sudden cardiac death and allow people to live a normal lifespan. For patients with hypertrophic cardiomyopathy who have progressive heart failure symptoms, there are new drugs to treat those with obstructive hypertrophic cardiomyopathy. There are surgeries to reduce the heart muscle thickness in those that have persistent symptoms and outflow tract obstruction. And finally, there's transplant for patients who do not respond to these other types of therapies. Finally, for patients who have a heart rhythm problem called atrial fibrillation and develop the high risk of stroke associated with this, there are medications and treatment options to treat atrial fibrillation to restore normal rhythm, as well as anticoagulant therapy to reduce the risk of stroke. As I mentioned earlier, most patients with hypertrophic cardiomyopathy don't know that they have this condition and therefore do not know that they may be at risk for these complications. Asking a few simple questions can therefore potentially save lives and reduce healthcare expenditure by identifying these patients for preventive therapies. Asking them questions about any symptoms that could be due to a heart-related problem is important. In addition, family members may know that they have heart conditions that put an individual younger patient at risk. So certain heart conditions such as heart failure or cardiac arrest in a parent would certainly raise concerns in a younger child. Finally, there may be patients who know about specific conditions in their family, such as hypertrophic cardiomyopathy, which is genetically transmitted. There are other genetic conditions as well that may be passed on directly to offspring, and understanding and recognizing this possibility is important in identifying those who may benefit from preventive therapies. Thank you very much for your attention.
And thank you, Dr. Wang, for sharing that with us today. Unfortunately, he was in clinic, so could not be with us live, so pre-recorded. Okay. And we're having a little technical difficulty here.
Hello, I'm Andrew Wong.
Give me 1 second. And we're not advancing.
I'm Andrew Wong.
We're not advancing our slide. Don't quite know what's going on there. There we go. Sorry about that. So we have initiated a new system a few months back at the HCMA, and that is a state report card. We want you to know how well your state is doing in not only understanding hypertrophic cardiomyopathy, but to also understand how to prepare for cardiac emergencies in the community and make sure patients have access to the care that they need. So we have taken an initiative to give you all a score, and we know that we all want to be the best that we can be, and we're going to give you a guideline to how you can improve HCM awareness, detection, sudden cardiac arrest preparedness in your individual community. So for the state of Delaware, we are happy to tell you that we're doing okay in Delaware, but we think we can do a little bit better. So thank you very much to the state of Delaware for recognizing HCM Awareness Day and making a proclamation for that. We also know that you have AEDs in your schools, but we could probably go a little bit further in where AEDs are available. You're doing great with CPR education and Good Samaritan laws and even copay accumulator and step therapy laws. Way to go, Delaware. But there are some other areas where we could do some more work, and that is within the HCM Act itself. And that would allow us to ask questions about family heart health history in the well child examination, as well as improving access to screening for student athletes by educated and knowledgeable physicians who have an understanding of these disease states that can affect young people and be otherwise asymptomatic, but have risk of heart disease. So you can go to our website at 4hcm.org and you can look at your state site and you can dig in. If we have missed anything in your legislative body that is on the HCM Act or in the report card, please do inform us. We will make updates as necessary, but we think we've gotten a pretty good scrub of the Delaware legislative language, and we know where there's some room for improvement. We want to take a moment to explain to you why the Healthy Cardiac Monitoring Act is important and give you a real life situation as to how it may have changed the outcome in one patient. So we're going to talk a little bit about a young lady named Jillian Blair. She actually lives in Iowa, but she is representative of many patients and many families throughout the United States, including those in Delaware. So Jillian's story is going to be told in part by her mother. And I want to just give you a little heads up that this is a pretty dramatic story. And unfortunately, Jillian is no longer with us. So let's put the puzzle together and figure out what we could have done to save Jillian. Just hit the key and it'll take to the next slide.
Thank you. Okay. So on February 15th, 2022, which is 2 years exactly today, my 17-year-old daughter, Jillian, and I, we walked into our family physician's office for her well child check. And while we were there, the doctor put her stethoscope onto Jill's chest and she turned to me and she said, "When did Jill get this heart murmur?" And so that appointment led to us going to see a pediatric cardiologist in Des Moines. And from there, we had the diagnosis of hypertrophic cardiomyopathy. And those words, severe and obstructed, they were still lingering in the air when we were waking up in Omaha, Nebraska to see specialists 1 week later. She went ahead and did a battering of tests. And then on Thursday, April 21st, 2022, the doctors were able to come back and give us our very last test result, which was her genetic test that she was positive for the MYBPC3 gene, which connects her to HCM. She came home from school that day. We went ahead and made an arrangement to see them on Monday and kind of get a plan of action. She came home an hour and a half later after I hung up the phone with the doctor, and I told her what they discovered. And she said, "Okay, that's about what I expected." She ran up the stairs where she had a sudden cardiac arrest. I was able to get up to the stairs within a minute or two. There was a lady who lived across the street who actually sold AEDs, so I had an AED on her within 2 minutes. But unfortunately, our efforts, the efforts of the EMS and the hospital staff were not successful, and we lost Jillian that day. So Jill was a very funny and outgoing girl. She loved music. She loved Harry Styles. He was her favorite. She loved art. She was really, really bad in algebra, and she wanted to be a designer one day. After Jill's death, it was like an explosion went off, and I started connecting dots within my family. And I talked to lots of families on my members of my paternal side, and I found out that we had a lot of similar heart problems. With the help of Omaha, we were able to get all of my siblings, all of my cousins tested. And when we discovered that I had HCM, half my siblings had HCM, 25% of my cousins had HCM. And from then, many of us have ICDs and have had myectomies. We have also lost them. My brother has died in a surgery that was a valve surgery for an enlarged heart. My nephew has had 2 myectomies. My sister had a sudden cardiac arrest 5 months after my my daughter died. And I just say that she died of a broken heart, since we're not ever sure exactly what it was. But my family is actually lucky because of Jillian, because she was our call to action. Because of her, my family has the power of knowledge to be able to fight against an invisible gene. But not all families are that lucky. But there is hope for them. Had there been questions that were in place when I took all of my girls to their well-child checks that we were asked each time, so that in 2010, when my nephew had his first myectomy, or in 2015, when my brother had died on the surgical table from his HCM, maybe some of the doctors could have put it together that we needed to do a little bit more investigation. Or when my 91-year-old father, who had HCM, and that's how he went down to, he had a sudden cardiac arrest. But if he had gone into his Medicare first visit and was able to tell them that he had 7 siblings who died, all of cardiac arrests, maybe that would have been a trigger to have them look at us a little bit easier. If we had gotten the treatment earlier, I'm hoping, it would have been hopeful that she could have got diagnosed earlier, which would have led to earlier treatment and maybe would have saved Jill's life. And lastly, I am a nurse in Iowa, and I work at a family practice clinic. It would take me 5 extra seconds of my day to ask these questions to a patient. And that would help save thousands of dollars, millions of dollars, and keep thousands of family intact and whole. I wish it wasn't me standing here, and I wish it wasn't my daughter. I wish it wasn't my family. And I wish it wasn't that I know the heartbreak that people go through. I wake up every day and I live a nightmare. But it is me, and it is my family, and it's my wish and my hope. And I wouldn't be standing here, and none of you would be hearing my voice if it wasn't for the life of a girl named Jillian Blair, and she had HCM.
So Jillian's story is a call to action. Jillian could be your daughter, could be your niece, could be somebody you know. And we don't want any more losses due to HCM. So we need to put the puzzle pieces together for families like Jillian sooner, more effectively. We need to get there in time. And there are things that you as a legislative body can do to ensure that we get there in time and put the puzzle together. And what you can do is called the Healthy Cardiac Monitoring Act. Yes, we were cute with the name because it comes out to HCMA, which is the same acronym as our organization, but it's got a very different call to action. We don't want to just find hypertrophic cardiomyopathy. We want to find all genetic heart disease that occur in the young. So let's take a look at what else we need to do. We're going to dive into some details here in a moment. So I have to show this picture of Jillian. She was just such a lovely spirit, and you need to look at this spark of a girl who's now gone. That spark was faded because we didn't get there in time. Okay, so let's talk about Derek Armstead for a moment. Derek is a different story. Derek had a family history that he really wasn't very much aware of because his mother died very young. And his mother was approximately 30 years of age. She had some heart issues, and she was on some list either for a transplant or for an evaluation. Because Derek was so young at the time of her death and his sister was so young, it was a little unclear of what was going on. But flash forward almost 30 years, Derek passes out at an event with his family. He's playing with his nieces and nephews, 4 and 5 years old, and he passes out cold. They bring him to the hospital, and they think he may have had some type of a seizure, but they just let him go from the hospital without any cardiac tests. And he went home. And a couple of days later, he was out running some errands and decided that he was going to bring his infant child home before he went to go get some dinner. He walked up the stairs with the child carrier because the baby was in, car seat, walked to the top of the stairs, and he dropped dead. And he was 29 years old, and nobody ever checked his heart, even though he had previously passed out. We believe that this is an issue related to health equity, and he was a young Black man, and he didn't look like he had heart disease. We need to stop and ask questions. Why did somebody pass out? What is going on in this family history? What happened to your parents? Are they living or deceased? Are they dealing with heart disease? Derek will never be here to raise his child, but his fiance has been very active in sharing his story and ensuring that we stay aware of HCM. And the HCMA is taking on some health equity initiatives to ensure that all people have access to know their family heart health history, and that these stories are told and shared so that we can raise awareness to save other families. So in Derek and Jillian's memory, we're providing you with this education today. So the All Hearts Collaborative is an effort that we're taking on to educate people in all communities about HCM and make sure that family heart health histories are part of the questions that we are asking when we're engaging with our healthcare providers. So what exactly is this Healthy Cardiac Monitoring Act? Number one, we want to ask every well child examination opportunity some basic heart questions. Is there a family history of heart disease? Has a child had any symptoms? What's going on in this deep family? Is there a history of stroke, heart failure, defibrillators, pacemakers, atrial fibrillation? We want to ask questions. Guess what? We can do this on a form. It's cost effective. It doesn't have to take extra time. And we're not looking to invoke a particular cardiac test. We're asking for a conversation between healthcare provider and family to talk about their family heart health history. In the state of New Jersey, we enacted this law in 2015, and we have seen a marked improvement in diagnosis and identification of individuals and families with HCM. If you join us tonight in our HCM Awareness Day webinar, you will hear the story of a family from New Jersey where the son was diagnosed through the Healthy Cardiac Monitoring Act elements, and then he went on to also be able to identify his father as also being affected with HCM. The goal is to keep families whole. So we need your help to legislate some very simple items to be added to the well child examination and to add some professional development tools so that clinicians are aware. In New Jersey, we are utilizing an online system, and you must complete the online portal on a periodic basis to ensure that you know as a clinician what the diseases are that you're looking for. And some of you may say, well, doctors know this stuff. Well, it depends on when they went to school and what they learned about genetic heart disease. So we can have an opportunity to re-engage them in these diseases, not only HCM, but long QT syndrome, Marfan syndrome, ARVC, which is arrhythmogenic right ventricular dysplasia, dilated cardiomyopathy, and other forms of genetic heart disease like Noonan syndrome and channelopathies and other RASopathies. So there's a whole group of diseases that we can identify if we ask the right questions. So that's what we're looking to do on the state level. And on the federal level, the reason why Amy Blair, Jillian's mom, was with us on Capitol Hill was to engage the Congress to add some questions to the Welcome to Medicare visit as well. So what we're asking of our children is just as important to ask to our seniors, and these will help us identify people with diseases earlier, get them targeted therapies, and thereby be more cost effective in our healthcare system. We know healthcare systems are burdened right now, and we don't want people treated for diseases that they don't have, but we also don't want them mismanaged or lost in the system for conditions that they actually do have. So this is what we're trying to put forward in the state of Delaware as well as all over the country. So let's look at Delaware's numbers. So you have roughly a total population of about 1 million, and there are about 200,000 that would classify as pediatric under the age of 18. So what we're talking about for Delaware are pediatric initiatives. So we will be looking at the Healthy Cardiac Monitoring Act and the well child examination and improving your student athlete pre-participation physical process. And what are we going to find? You have between 10 and 31,000 individuals in the state of Delaware alone who have an identifiable genetic heart disease. And if we're not asking questions, we're not going to figure out what diseases these children have, these families have, and we're not going to be able to get to care in time. So asking a few questions can open up the conversation to help identify the many that are misdiagnosed or underdiagnosed or just flying below the radar right now. So how are we going to do this? We're going to get out and tell our stories. We're going to do events like this. We're going to engage you. These are some photos from our Hill Day. We had a number of individuals join us, and where we're at the Hill, we hope to come to your state house soon and talk to you in person about the initiatives that we have as well. So we hope to see you soon. We have a number of states, including Delaware, thank you very much, who have already made HCM Awareness Day something that you are recognizing by either proclamation or resolution or state law in some cases. And here is one of our HCM advocates right in the middle with her HCM Awareness Day proclamation from the state of Delaware. And she is our state representative and our state champion for this legislative initiative. And her name is Bielu Daus, and we will pictures on actually on the next slide. So I'm going to leave this one up for a moment. If you want to have a conversation with us, we want to have a conversation with you. So we're asking you to either email us at support@4hcm.org or use this QR code to set an appointment so we can have more in-depth conversation with you. And our state legislative champion, Bielu Daus, and myself will be available to answer any questions that you have. And we are more than happy to engage with you and your staff to find easy ways to make it possible that families with HCM and other genetic heart diseases have an opportunity to be identified and seek appropriate care. We thank you for joining us today for this briefing. I will stay on for a moment. If anybody has any questions, we are more than happy to take them at this time. You can use the chat feature and we can have a conversation, or you can call us at the office. And our contact information is on the screen right now. And not seeing any questions yet. I will just pause for a second. And I think we have finished our first of 6 briefings of the day. And I thank you all for taking the time out of your very busy schedule to join us for a few minutes to learn more about the Healthy Cardiac Monitoring Act and what you as state legislative body can do to help identify those with genetic heart disease to ensure that families stay whole. Thank you very much for joining us today. And if you're interested in learning more about HCM or the HCMA, you can join us this evening at 4hcm.org, and you can join us for our HCM Awareness Day and State of the Union address. Thank you so much and have a wonderful day.